Hi there. Okay, today we are talking about sports performance, injury, and how to prevent injury. And we're talking about concussion, we're talking about muscle tears, inflammation. That's what we're talking about. When we talk about CBD, and I'm talking about the hemp plant, not the marijuana plant. The marijuana plant is CBD that you get from the dispensary. The hemp plant is CBD that comes from the hemp plant, has no THC in it, is a dietary supplement, is legal to transport, to ship anywhere in the country and mostly anywhere in the world except for Asia. It will not, CBD hemp does not fail a drug test because they're looking for THC. Okay, so when you have a good product like Elixinol, or you have my Will's Wonder, which is a CBD immune booster, whatever type of CBD you have, if you take it twice a day, once in the morning, once in the afternoon, more like close to dinner time, every 8 to 10 hours, we metabolize the CBD out of our body. And did you know that we make CBD in the body? And we make CBD from omega-3s. So it's very important for my sports enthusiasts, my athletes, my people who are working out, women who are over the age of 50 have lost their hormones and now need to supplant with omega-3 fatty acids. That's fish oil. It's very tough to get a very good fish oil that doesn't oxidize. When you put a raw salmon in the fridge and you forget to grill it the next day, it's a little stinky. The fish oil is very sensitive, so you must have a good product like Designs for Health where your fish oil will not oxidize, it doesn't make you burp, it doesn't give you stinky breath, it's very stable. Okay, we make CBD from omega-3s. DHA and EPA are the specific omega-3s that we're looking for when you're taking a supplement. You want about 2,000 milligrams a day. Of course, you need your vitamin D, another anti-inflammatory. It's actually considered a hormone now. You take your vitamin D3 plus K2. Vitamin K2, very important. Otherwise, you're going to create more joint pain, okay? So vitamin D3 plus K2, your zinc. 40% of all of our muscles are made of zinc. So it's important for women especially to supplement with zinc. Men out there who have prostate issues, zinc. Okay, so we have CBD creams, balms, sprays that you can spray. You can actually spray or mist it in the air and inhale the mist, and that will go through the blood-brain barrier, helps for anxiety. I've got a lot of people who are bipolar who love it to calm the nervous system. Another thing that calms the nervous system, sea salts. CBD infused sea salts. When you soak in this bath, it pulls out the lactic acid, it pulls out the metabolites that we have, even from digestion, it pulls out the toxins, and then the CBD is anti-inflammatory. And this all is worked under this system in our body called the endocannabinoid system. And guess what? Your CBD jumpstarts the endocannabinoid system. THC from the dispensary does not jumpstart the endocannabinoid system. And this system is in charge of modulating inflammation. So when we get hit in the head, we get this trauma, and then we get this secondary inflammation from the body sending all these cytokines to the brain. Well, what happens is we get tissue necrosis, we get tissue death, we get this, we get a lot of blood flow, which turns into dried blood, which turns into calcification, which turns into inflammation. It's the secondary inflammation from a concussion that does all the tissue damage. So when you get a concussion, when you get injured right away, whether it's a muscle tear, a knee injury, or a brain injury, you want to take your tincture, Put it under the tongue, couple, 4, 5, 6, 7 drops. I usually go overboard for the first 4 hours. I do about 10 drops of CBD under the tongue. Hold it for 2 minutes. Put your CBD cream all around your eye. If you got hit in the eye, all on the temples, wherever you got hit, on the knee, on the ankle, on the elbow, wherever you get hit, that's where you want to put the CBD cream. And then you want to tincture so the endocannabinoid system can push into gear through the bloodstream and help reduce inflammation immediately. Okay, my soccer buddy Eva had a golf-size lump on her shin after getting kicked in the shin. We raced off to the sidelines. I put the balm on it. Literally in 5 minutes, that golf ball size went down to nothing. She had a teeny bit of a bruise, and that's it. So it's really important to use your CBD immediately after an injury. Always before a workout, always before physical therapy. If you're getting your neck adjusted or something like that, you want to put the CBD cream on before you get adjusted, before your PT, before your workout. Keep the inflammation at bay. Don't chase it. Okay, that's your tip for the day. For all you athletes out there, get your omega-3s, get your vitamin D3 plus K2, and get your CBD. Thanks so much. GreenAlleyCBD.com, GreenAlleyWellness.com.